Hello, this is Dr. Joe Gary from Mosa Plastic Surgery. Welcome to the Surgeon's Corner podcast. Our topic of discussion for this episode is eyelid surgery, otherwise known as blepharoplasty. When patients present with complaints related to the periorbital region, they usually express the changes they see around their eyes as giving them a tired, sad appearance. In our last podcast, we focused on the eyebrows, specifically on the changes related to aging and what can be done surgically to restore their youthful shape and position. On this podcast, we will discuss the other important components of the periorbital region, those being the eyelids. We will discuss, number one, the anatomical considerations pertaining to the eyelids, changes that occur with aging, and surgical options to correct those changes. In understanding the changes related to aging around the eyes, it is important to first review the anatomy of the region. The eye, or the globe, as it is sometimes referred to, sits in a bony cavity of the skull known as the orbit and is surrounded by muscle and fat. The muscles that surround the eye allow for eye movement, and the fat cushions and protects the globe. The eye is protected and covered on its anterior surface by the eyelids. The eyelids themselves include a cartilaginous framework called the tarsus, which is covered by muscle, skin, and on its anterior surface by a mucosal layer called the conjunctiva. The tarsus gives some rigidity to the eyelids and has a connective tissue attachment called the septum. The septum is a relatively strong tissue plane known as fascia that keeps the fat that surrounds the globe in its proper anatomical position and prevents it from bulging forward. With aging, there is usually a loss of elasticity of the skin, which allows for the appearance of skin wrinkles and leads to redundant skin in the eyelids. Laxity of the fascial layer attached to the tarsus, called the septum, allows for the pseudoherniation of fat or bulging seen in the upper and lower eyelids. Other age-related changes, such as descent of the deep fat compartments of the face and overall tissue loss, leads to a demarcation between the lower lid and the cheek, and contributes to the formation of a groove between the eyelid and the cheek adjacent to the sidewall of the nose, called the tear trough. All these aforementioned changes, along with the concomitant descent of the eyebrow, contribute to the age-related changes seen in the periorbital region. The typical patient that presents with complaints related to the area around the eyes usually points to excess skin of both the upper and lower eyelids, as well as fat bulging, or bags, on their lower eyelids and sometimes in the area adjacent to the nose on their upper eyelids. Sometimes these features are made worse by associated rhytids or wrinkles, which are more usually prominent in the lower eyelids and the skin lateral to the eyes, particularly when the patient smiles or laughs. These wrinkles are commonly referred to as the crow's feet. In assessing a patient who presents with concerns regarding their eyelids, it is important to first explore their medical history to elicit any pertinent issues with their eyes, such as glaucoma, use of contact lenses, or symptoms related to dry eyes. It is also important to rule out other related issues such as ptosis, a condition in which the upper eyelid sits in a position lower than normal and can also contribute to the patient appearing chronically tired or sleepy. Although these medical conditions are not absolute contraindications to aesthetic eyelid surgery, they do need to either be addressed at the time of surgery or accounted for and managed in formulating a proper surgical treatment plan. Another extremely important point of discussion during the initial consultation is to address the brow position. Although most patients do not present initially with brow complaints, it is important for them to understand that brow ptosis or descent has the effect of increasing the amount of redundant skin associated with the upper eyelid, particularly laterally, a condition commonly referred to as lateral hooding. It is paramount for patients to understand that if significant brow descent exists, this should also be addressed at the time of surgery so as to enhance the overall aesthetics of the periorbital region. In patients who present with complaints of aging around the eyes, it is not uncommon to perform a brow lift at the same time as eyelid surgery. When these procedures are to be done concurrently, it is important to perform the brow lift first, as properly positioned the brows first takes care of the excess upper eyelid skin and hooding that is contributed to by the brow ptosis. After the proper eyebrow position is set, then attention is directed to the eyelids themselves. As the anatomy of the upper and lower eyelids are not necessarily exactly the same, the surgical approach is slightly different for each. On the upper eyelid, there is usually an incision made in the area of the upper eyelid crease along the entire length of the eyelid. The excess skin is then pinched off with forceps and upper mark is made so as to be able to remove the excess skin of the upper eyelid in the form of an ellipse. Once this excess skin is removed, a decision is made as to how much, if any, fat is to be removed from the two distinct fat compartments found on the upper eyelid. This fat is teased from its anatomical location using surgical forceps and usually removed by electrocautery. The amount of fat removed is just enough to correct the appearance of fat herniation or bulging noted in the preoperative examination. After addressing all bleeding and washing the surgical site, the skin edges are approximated and closed with fine sutures. There are several techniques commonly used to address the lower eyelids, and the technique used is based on anatomical considerations and surgeon preference. As with the upper eyelid, the main goal of surgery of the lower eyelid involves addressing any potential fat bulging in any or in all of the three distinct fat pockets associated with the lower eyelid, as well as addressing the skin excess. The fat resection of the lower eyelid can be done through the skin incision, as with the upper eyelid, or it can also be assessed through an incision on the internal part of the lower eyelid, which abuts the eye. This technique is referred to as the transconjunctival approach. The excess skin is usually managed through an incision made about 1 millimeter below the eyelashes of the lower eyelid. After pinching off the excess skin, or after raising a small tissue flap and superimposing it over the prior incision, the excess skin is severed with fine surgical scissors and removed. Just like in the upper eyelid, the incision is then approximated with fine sutures. Besides the typical steps performed in eyelid surgery or blepharoplasty as described above, sometimes other concomitant procedures such as canthopexy, canthoplasty, or eyelid ptosis correction can be performed as indicated. The discussion of these procedures is beyond the scope of this particular podcast and will be discussed in future ones. Fine-tuning of the results of blepharoplasty might also involve other adjunctive treatments, such as the use of neuromodulators like Botox to address wrinkles that extend outside the eyelids themselves in the lateral aspects of the eyes, known as the crow's feet, or laser treatments or peeling to address residual fine wrinkles that might be persistent after a particular eyelid procedure. At times, filler injections or fat grafting is used to fill in the hollow or groove sometimes seen underneath the lower eyelids called the tear trough. Blepharoplasties can be performed with local anesthesia alone in an office setting. Most patients, however, opt to have the procedure done with IV sedation or general anesthesia in an ambulatory surgery setting. The procedure usually results in moderate swelling and bruising, which can last up to 2 weeks. The incisions usually heal extremely well and can be difficult to see after 3 to 6 months. In conclusion, blepharoplasties of upper or lower eyelids, or of both, whether performed alone or in conjunction with a brow lift procedure, is an excellent surgical option to correct periorbital aging. Adjunctive procedures can also be performed to correct associated issues such as eyelid ptosis or to enhance surgical results. These procedures are well tolerated, can be performed with minimal to moderate downtime, and when properly indicated and done, result in a natural restoration of periorbital youthful appearance and contours. Thank you very much for your time and attention.